Record. And students, we are excited in here with Dr. Sarah Webb, who is a veterinarian. And I know a lot of you have been asking, can we interview a veterinarian and kind of figure out about their daily life, what it takes to actually become one, and what is it really like when that door closes and you're working with all these different animals. So Dr. Webb, thank you so much for your time today.
No problem. No problem. Hi.
And if we want to kick things off, I think an interesting thing we were talking about before recording was that kind of what is the path it takes to eventually become the Dr. Sarah Webb. So if you could kind of go through that a little bit, we would love to hear your journey.
Yeah, definitely. I mean, I think mine was probably maybe a little different than some, but always when I was growing up, loved animals.
Mm-hmm.
Lived in the country. I'm from Iowa. I lived in the country. I'm always at my aunt and uncle's farm, and all this stuff. And I'm like, I love this. This is what I want to do.
Yeah.
I want to work with animals. Then, of course, you get through high school, and I'm a senior. I'm getting ready to graduate and deciding where I'm going to college. And I'm like, I don't want to go to school that long. Like I'm on the, I want to do the 4-year thing and out. So I actually ended up going into engineering first.
Okay.
Did that for a semester. Didn't like that. Then I went into accounting for a little bit. Absolutely not my thing. And so then I ended up back on biology. And so, again, I still wasn't thinking at that point back to vet school, just time-wise, I guess, more than anything.
Sure, it's a big commitment.
Yeah, but then as I got, kind of probably junior year, and I started to really, you really then start to think about, okay, what am I going to do with this degree? What am I actually liking out of this? Then I came back around and kind of, with the encouragement, of course, my parents and stuff, like, kind of came back around. I'm like, maybe I should look into the vet thing again. So I ended up back in pre-vet. Undergrad, I did in 4.5 years because I had kind of taken my time, I guess, figuring that out. And so luckily got into vet school right away. So then that's 4 more years. But it's pretty cool. Once you get into vet school, you're starting to see how you're going to apply all of that, and so, then you really get your purpose and and your drive. And so it ended up to be very cool. It took me 9 years. Some people, it is possible to go, if you're kind of dedicated, and there's a lot more AP opportunities now, I think, than there was when I went through school. Well, I mean, maybe in Iowa too, I don't know. Like there's a lot of AP opportunities I've already seen out here. But you legitimately don't have to get an undergrad degree. Okay. You can go for 2 years, and then if you're good enough and you have enough experience, you can go into vet school from there. So you
really
can get done in 6 years. But I felt like some of the people that had done that in my class maybe were a little young and not, I think you do miss out on some things doing that, being younger and stuff like that. So that was kind of my route. I kind of faltered a little bit as I graduated high school and trying to decide, but it ended up being good, I think, for me in the end.
I think you brought up a good point, and a lot of my guest interviews have said the same, that you change your mind in college sometimes, what you think you want, and that's completely normal and natural. Yeah. And there's always that conflict of money and time with college, and what are you going to do? But in the end, your career is a long investment, so you want to end up in something you're passionate about.
Oh, yeah, absolutely. You should definitely honor that feeling if you're like, I don't really know if I like this right now. It is. I'm so glad now that all of that turned out the way it did.
So how about, did you go to school in Iowa? Did you stay in Iowa, or did you go out?
Nope. So I went to University of Iowa for my undergrad, and then I went to Iowa State for vet school. Cool. I got accepted, I think, to like Minnesota and somewhere else, maybe Missouri for vet school, but I decided, and again, some of that's money, tuition is cheaper and closer to family and stuff like that. So, and then, I moved out here right after graduation. So.
Excellent. Well, that's super cool. And 9 years, again, to reiterate, is a long commitment. So when thinking about a career in vet and that, you have to be prepared that it could take quite a bit of your time. So that's great that you
Absolutely.
brought up.
Yeah.
How was vet school? Was it different at all compared to undergrad? You mentioned that in vet school, obviously you started seeing the application and the purpose, but as
Yeah.
far as like rigor and time commitment in that, did you feel like there was a difference, or it was just more specific?
Yeah, vet school, I mean, it's difficult,
Mhm.
it is, it's pretty intense. I mean, one thing that's important, it's hard to have a job during vet school. Like, there's just, and it's cool in a way though, you're with the same, like I think there were like 105 people in my vet school class, like you're in it together, that whole 4 years. And so there is a lot of kind of camaraderie with that. Um, but yeah, I would say it was a step up from undergrad for
Yeah.
sure, like difficulty. But again, like kind of that first year of vet school, it's a lot of, again, the building blocks of things where you can't necessarily apply it as well. But then from then on out, you kind of start to apply it, and so it gets you a little more excited. You're seeing your end game, and so it was hard, but I mean, I've already forgotten a lot of it. I'm like, that's fine, or the hardness of it. I'm like, it was fine, it was
Yeah.
hard, but once you get into your fourth year, your whole fourth year is clinicals, and so that's all exciting, even though it's still hard work.
Yeah, I'd love to hear about the clinicals. Do you end up going to numerous places, or do you get, like for me, student teaching, I went to a school and taught a semester there.
Yeah.
What's clinicals like for a vet?
So you can make it, like a lot of them are at the school. So, there's a teaching hospital, and so a
Yeah.
lot of it is there with clinicians there, and you do different 2-week rotations, like small animal medicine, orthopedics. I actually did an equine as kind of my second track. So I did a lot with horses at that time too. Um, but then I also like went to an animal shelter and did spays neuters, and and we have some students coming to us for externs and things like that. And so you usually have some options with a couple of your blocks to go and do it wherever you want. Like there's some that are overseas and stuff
Wow.
like that. So you can really kind of spread out and kind of get a taste of other things at that point too. A lot of it's at the school, but
Did you feel like during your clinicals is when you really, really started learning, or did you feel like with the hands-on, or did you feel like all 4 years it was just like nonstop? Wow, more and more
yeah.
information in that.
I mean, clinicals was so cool because, you've done some stuff through case studies and everything, and then you actually see one and you're like, I think it's this. And then it's
Yeah.
like, it is that. Oh my gosh, I'm so smart.
Yeah.
You start to kind of put it, I mean, and I think, again, I took the equine as my second track and then small animal. You also start to realize, I'm like, I don't want to work with horses. They're really cool. They're pretty. I love them, but I'd rather do the small animal thing.
Yeah.
So it kind of helps you to figure out where you want to go.
Awesome. Awesome. So, well, thank you. That paints a great picture of the college and to getting there. So now that
Yeah.
you became Dr. Sarah Webb, what was that process like? Like now you can be a vet. What do you do next? How does that work?
Yeah, it's terrifying. Yeah, when you first get out, like I still remember. Yeah, so I came out here. I took a job out here. Moved with my husband out here, and I mean, at first you feel like an imposter.
Sure.
They're like calling you Dr. Webb, and I'm like,
Mm.
that's so weird. But I mean, vets are different as far as doctors because you don't have to do like a residency. You don't have to, kind of go into those tracks. You can if you want to get board certified in something, if you're really into neurology or surgery or, things like that.
No.
But you don't have to. Like they've basically trained you to be, I mean, they say they're training you to be a continual learner. Like you
No.
now have the building blocks, but now it's up to you to stay on top of new information, new medical treatments. And, but I luckily landed in a job that in a busy practice. I mean, and it's getting busier all the time. It's way busier now than when I first started, but I had great mentorship, like
Mm.
great mentorship. So, I mean, now I can do things that if you would have asked me back then, I'm like, no, that's a specialist. Only a specialist does that, So
Yeah.
So I kind of lucked out there. And I liked that. I mean, that's why I chose that hospital. I liked the situation where there were a lot of other doctors there, So I think when I started, there were like four or five other doctors, and they all, like they take you under your wing and kind of show you the ropes. And I'm like I said, now I just know so much more. So it was a process. Like I said, at first you walk in, you're terrified for sure.
I think, well, teaching your first year by your class all alone, it's like, oh, here we go. I'm 22,
Yes.
and they've got brothers and sisters older than me, probably,
Yes,
and
but
I'm
listen
telling,
to me.
yeah, I'm important.
Yes.
So that was some great points here. The fact that the lifelong learning, that you're continuously learning, and that
Yeah.
reaching out to other professionals that you can learn from, I think that overlaps with
Yeah.
so many jobs. And I think that's wonderful advice. So thank you for bringing
Yeah.
that up. How about if
Yeah.
we took a slice in your week at work? What would a typical day look like when you're being a vet?
Um, well, I think it probably depends on what practice you're at. Like,
Mm-hmm.
practice I work at is a walk-in facility, so you never know what's coming through the door.
Yeah.
You could, take one off the list that's up to be seen. It could be a new puppy visit that's
Okay.
super cute, or it could be a dog that's like got a broken leg, or it's all sorts of. So we're kind of, we have that kind of general care for vaccines and preventatives, all the
Mm-hmm.
way to you can walk in here with an emergency with a dog in labor that needs a C-section,
Oh my
like
gosh.
things like that. But I mean, I found that I love that. Like, it's crazy, but I love it. So some days are super routine and kind of just everything's routine, and other days are crazy and maybe a little more stressful.
Yeah.
But I think you find that those things are also very fulfilling, like the days I do all vaccines, I might be like, okay, I feel pretty good. And then there's days where it's like, man, I really did this and it was great.
Yeah.
Um, there's definitely different practice scenarios, though. There's some that are more, they've got their appointments laid out, and they may take one emergency in at a time, and they know what it is, and they can either accept it or deny it, or send
Right.
it elsewhere. So I feel like my practice is definitely a little bit more high speed and stressful than maybe some of the, the 1-2 doctor family practice,
Yeah.
And there's days that you don't feel great about it. I think that's medicine in general. You can't control everything. There's always a price tag to everything, which sucks. There's not as much insurance for animals. And so, there are some hard situations. I'd be lying if I didn't say that. But,
Sure.
the end of most days, I feel very good about what I do.
Yeah. Well, I can imagine you can see your passion and excitement towards it just from how you talk about it. So I think
Yeah.
that's great for students to see. That's a great role model you're setting. So thank you for saying all of that. So during your day, it sounds like your job is rarely boring because you never know what's coming through the door, which
Yeah.
I think would interest a lot of people. And again, I think there's other people who would like the consistency planned out. So that's cool that you could have those different options depending on what practice you end up in or set up. So that's great to know for experience. How about, so you could be giving vaccines, you could be doing a emergency surgery, you could be splinting. Do you splint dog legs? Forgive me.
Splint. You can do surgery on them.
Oh.
Yeah, I don't do surgery on them, but one of our doctors does. So
that's amazing. Is there the office side? Is there like lots of paperwork? I mean, things like that. Is that part of the job too, or is it more you get hands-on and then depending on what practice that paperwork gets handed off to someone else? Just curious what that's like.
Yeah. I mean, we have a lot of support staff. So, we have technicians, and, they do a lot of the, so say I take in an animal that's sick and needs to be hospitalized. They're the ones I write out a treatment sheet. They're the ones that place the IV catheter and administer the meds and do the treatments. Really the only paperwork side for me is medical notes. I mean, you have to note all of that. When I first started, that was all paper notes. You're writing them out. Now we're paperless, so it's as simple as typing it into, our computer system. Again, we're pretty, and like right now we're very busy because a lot of practices have kind of decreased their hours and stuff with the COVID and just a different flow, I guess. And so, some of those medical notes I do at home, after work, to kind of finish them up. Usually maybe maybe a half hour, an hour after I get home or something, I work on those. So there's not a lot of paperwork. I mean, we have, we have a lot of support staff, the technicians, we have kennel staff that are helping restrain and, and kind of caring for the animals. And the receptionists take care of a lot of the other kind of in between before we even see the animals. Yeah. So we're kind of, in a perfect world, we're just coming in and using the medical side and saying, okay, this is what we need to do. And we either do it if we need to, or we pass it to, almost the technicians are like our nurses. So.
Yeah. Oh, that's interesting to hear. For my students that really love animals and are interested in this, there's a couple things, right? The time to become a vet and also the financial side. Are there other opportunities? You kind of mentioned already, like vet techs and things like that. They're like your nurses. What kind of opportunities are there working with animals besides just being the vet?
Yeah, I was going to say that the technicians' jobs are, I think, very interesting as well, and they don't require as much schooling. They don't even have to be certified to do that.
Okay.
We do have, most of ours are certified where they've done like a 2-year course at like JJC or Fox College. Mm-hmm. So that would be an option. I think the big thing too, and our kennel staff, a lot of them are high school or beginning college. Those are a good way to at least try to get your foot in the door, because first of all, it's going to get you to see some stuff, behind the scenes and see, is this something that you're comfortable with? Because it's not just sitting there petting a dog,
Right.
Giving that dog shots, which it may not like, or, or you're seeing things that are sick or hurt. But also when you're applying to vet school, they want to see your grades, they want to see your test scores, but they also want to see that you have some sort of experience, because, when I applied, we didn't have interviews. And so, they're taking you on your word on a lot of that you're not, that you're going to be okay if you do make it through vet school and be a good vet. And mm-hmm. So, they are going to take experience, kind of into that equation when they're looking at your application too. The other thing, and, I guess I'll throw my name out there, but like, you can always look into shadowing a vet. We've had a lot of high school students, and we're always willing to do that, just to kind of come and hang out for a couple hours. And again, just see if that's something that excites you, or if you're like, oh, no.
Or traumatizes you.
Yeah. So, the other thing too, which when you were talking earlier, if you do, kind of like the veterinary medicine, but there's also options other than going into practice too. I worked a summer when I was in vet school at the USDA doing this, this lab work on Clostridium or something, but it was very interesting, and so there's other tracks that you can take, where you're not in practice dealing with the general public and their pets, so that's another thing just to be aware of.
No, thank you. Those are great suggestions. And I think there's a lot of animal lovers in the world, and a lot of students always think, well, what a great way if I could find a way to be with animals, help them and make money and support my life or family. Yeah. So that's great just to hear other options besides, only that's the only way you can be with animals. So thank you for bringing those up. I want to respect your time, especially since it's your day off. Thank you again for that. But one quick thing, do you have any advice on skills for students, or as they're going through high school or college or when working, anything that you find seems to help in your job or that they can practice? And I don't want to put you on the spot, no worries there, but like you're dealing with animals, but also humans. So I think communication comes up a lot, but are there any skills you think that are important in your field?
Yeah, I mean, you look back at your science classes and stuff, and, and you do realize, like, oh, there's a reason you learned that stuff when maybe you couldn't really see how you would apply it. Now, I'll be honest, we do sometimes joke like, I didn't really need to know that, but
Sure.
it's all just a progression. It's a building up to something that applies to something that you want to do in the world, and so I think, and again, in the first couple years of college, you're kind of like, I don't know why I would ever use physics and, and things like that. But, you do try to keep your focus, I guess. It is hard because
Hmm.
it is a long time to be in school. But I think the other thing is, and you kind of brought it up, you think of vet medicine and you think, I'm just going to play with animals and deal with their problems. You are totally dealing with the person that
You're
is
right.
attached to them. And so, that's something that I don't feel like we were prepared enough in vet school, was the, kind of that side of it. They kind of glossed over that. And when you get out, you're like, oh my gosh, these people, this is their kid, and, and you're dealing with that. So I do think like communication is huge, like maybe not pushing all of that stuff like, oh, I don't need to do speech, or I don't, you do need to know how to be able to convey what is wrong with their animal and what should be done to them. Because you're the advocate then for the animal. Like,
Right.
this is what's best. I can only tell you what's best, and now it's up to you. So.
Yeah. No, that's perfect advice. And you're right. An animal is like a child to that person. So they
Yeah.
have an emotional attachment to the animal. And obviously you care too, but sometimes you have to tell things to the owners that they probably don't want to hear because they're upset
Yes.
or that. So,
Yeah.
or again, like you said, money always creates an interesting dynamic that unfortunately this surgery
Yeah.
is going to cost $2,500, and it's
Yeah.
like, whoa. So that was
Yeah.
that's a unique part of the business side of things that you're right. Probably colleges and schools don't really prepare anyone for.
Yeah. So.
All right. Well, thank you. You brought up some great ideas, great advice. And I think a lot of my students who are animal lovers in that, this helps them just kind of push themselves into your shoes and see where they fit in that. But
Yeah.
this knowledge has been so important. We really want to thank you for your time.
Oh, no problem. Thanks for having me.
Yeah, no worries. I'm going to officially hit the unrecord button.
All
Thank you
right.
again.